A very good morning to Madam Huda. Uh, it's not morning now, it's afternoon. A very good afternoon to Madam Huda. And now I'm presenting my sheet for physics, which my topic is Cherenkov Luminescence Imaging, or also known as CLI. So first of all, I'm introducing to you the physics concepts. So, Cherenkov radiation is a form of energy that we can perceive as a blue glow emitted when the electrical charged particles that compose of atoms, electrons, protons are moving at a speed that faster than the speed of light in a specific medium. I would like to clarify that it's not that the particles can move faster than light, but it's that when in the specific medium, for example, in water, the speed of light is reduced to almost 2.3 times 10 up to the power of 8 meter per second. As shown in the presentation here, you can see my calculations. So if in the water in that specific medium, the speed of particles is faster than the speed of light in that medium, hence a blue glow light will be emitted. And this is due to the physics concepts, which is the charge when a charged particle polarize other particles and the other particles excited and they absorb energy and then they re-emit the energy in the form of photons, and the photons is why the blue or the violet glow occurs. And next, I'll focus on the process. And actually, the CLI, the Cherenkov Luminescence Imaging, make good use of the photons emitted by the Cherenkov radiation that I mentioned just now. So the process of CLI would be the first one, radio tracers administrations, which is the radio tracers such as the 18F MDG is inserted into the subject or the patients by using maybe via mouth, via injections, and etc. And second one, Cherenkov light emissions. This is when the Cherenkov radiations occurs and the photons are emitted. And I would like to introduce to you a phenomenon that you will probably heard about, which is the sonic boom. And also similar to this phenomenon, where in these conditions is the particles move faster than light, but in sonic boom, the jet or the airplane moves faster than the speed of sound. Yeah, so that's why Cherenkov radiations occur. And the third one, the optical photon propagations in tissue. So when a Cherenkov light is emitted, it needs to propagate through the medium, which is our blood, our skin, and etc. So here I would like to introduce some of the limitations, which I will also emphasize on this on the later part of my presentations. The limitations will be only photons from the surface or near surface regions, which I will call it as the skin or the superficial lesions. Yeah, so only a few millimeters deep can escape, which limits the CLI imaging depth. And the fourth process will be the optical detections, in which we'll use some top-notch sensing device, the detector, such as the EMCCD, the electron multiplying charge coupled device, or the SCMOS, the complementary metal oxide semiconductor. And the camera captures the faint Cherenkov photons, which is the blue violet light that I mentioned just now. And yeah, the white light image may also be captured simultaneously for anatomical reference. And this process, the optical detection process, typically take a few seconds to only a few minutes. And the fifth process would be the image reconstruction and processing, which we know that when they capture photos, especially those professional photographer, we need to edit it. We need to edit it, like remove the background noise and so on. Same goes to the CLI. We have to correct this optical scattering and absorptions, reconstruct the quantitative maps of traces distribution, and so on. And next, the sixth one, last but not least, the image interpretations and clinical use, in which the physicians or the optical surgeons when they perform the surgery, they can use the CLI to detect tumor margins or verify radiotraces uptake. And here, the development of the CLI also involves the use of CLI during intraoperative surgery. And here is the development of CLI. In 2009, it was first be introduced, the CLI. It can be detected by using merely an optical camera, which is very distinct from what the expensive detector used by, for example, the MRI, SPECT, and so on. It used only cool charge coupled device to detect the faint blue light. And next, 2012 to 2014, the detector is improved, which will use the EMCCD, which is electron multiplying charge coupled device. We also use like the specific CMOS camera, which lead to less noise in room temperature, faster frame rates, and also larger frame of view. And next, the CLI was first used in human clinical studies, which it is used in the thyroid disease imaging. Yeah. And next, there are development being done, which is a Cherenkov Luminescence Topography (CLT) is being developed, in which it overcome the limitations of CLI, because CLI only can produce a two-dimensional image, but the CLT can produce a three-dimensional image, though the CLT is now still under development. And second, the next one would be the fusion between CLI and endoscopy. Here comes the Cherenkov Luminescence Endoscopy (CLE) for imaging of internal surfaces, for example, our colon, our stomach, and so on. And next, besides, we also have intraoperative molecular imaging, which is the milestone, which set the milestones for the CLI. We can use it for real-time imaging, like what I've said just now. It's very useful for intraoperative surgery, in which the intraoperative surgery here means that the surgeons can take a view of the conditions, the inner conditions of the patients while the surgeons is conducting the surgery. So it's real time. It's like you are watching a YouTube live via the YouTube platform. And next, we have the secondary Cherenkov-induced fluorescence imaging, which is the sci-fi. It emits light at longer and near infrared wavelengths, which have a longer wavelength, and so it can penetrate a deeper tissue. And next, we also involve the usage of activable or smart imaging agents. It's to visualize specific biological process, for example, the enzymatic process. And next, we have in 2016, we have the Cherenkov Luminescence Imaging Dosimetry, CLID. And here are some comparison that I made between some of the PET, SPECT, and also MRI that we commonly use in everyday life. Not really everyday, who wants to see a doctor every day, right? I mean, used by the doctor every day. Yeah. So first of all, in terms of resolution, CLI won against PET and also SPECT, and in terms of instrumentations, CLI also use only low-cost optical camera like CCD, CMOS, and for your information, CMOS is the type of sensor that we use in our daily life, in our smartphone. And third one, output speed. Like I said just now, CLI can be used in real time for intraoperative surgery. So CLI offers a fast and real-time imaging compared to PET and also single photon emission computed tomography. And informations, CLI offer molecular informations, which involve the use of radio tracers. And next one, which is the second of the application. So the application so like I mentioned just now, CLI can be used in image-guided surgery, particularly in cancer resection procedures. CLI is extremely effective in breast conserving surgery and also glioblastoma resections. And for your information, FET, which is a type of radio tracers, induce Cherenkov luminescence imaging, outperform the current standard of 5 ALA fluorescence imaging, achieving more than 92% of sensitivity. Yeah, that's really impressive. And the second one, it can be used also in the radiotherapy quality assurance, in which CLI system in radiotherapy has identified treatment anomalies and not detected by conventional methods, which I mentioned just now. For example, conventional methods like the SPCT, the PET, so on. And in 1 year, CLI detected 9 treatment incidents, including those with unintended areas, oxygenic errors, and non-ideal bolus placement. And we also use CLI for the imaging of superficial lesions. And for your information, superficial lesions here means the skin, our outer layer of the skin. So yeah, it's non-invasive detections of nodal disease, which means it's less pain and also more gain, less pain, more gain. Yeah, it rhymes. And next one will be the limitation. Like I said just now, everything's have the bad side and also the good side. So here's the limitations. First, it had limited tissue penetrations. Cherenkov photons, because its photons are mostly in the blue UV range, it's heavily absorbed or scattered in tissue. So it can't really be used for deep-seated cancers, the tumors. So the second one would be the quantification accuracy challenges. Quantification here means like depth. So though I must say that just now I mentioned about the development of CLT, the Cherenkov Luminescence topography. Although we can obtain a 3D image like PET, but it's challenging. It's due to the light scattering issue, like I mentioned just now. And the third one would be the environmental requirements. CLI requires a complete ambient light removal, which means we need a dark room. And maybe in dark room, the patients will feel afraid, feel scared, and it's not quite comfortable for patients. And the fourth one, with lack of real practice and CLI, we know that if you go to a clinic, hospital, the doctor will maybe told us to go to MRI, the PET, SPECT, and we rarely use CLI, and we rarely heard about CLI, which is the reason, the main reason why I'm introducing to you CLI today. And the third part of the SHE would be the communication and collaboration. So first one, International Atomic Energy Agency, IAEA, they support for CLI development through its quality management audits and nuclear medicines quantum program. So, for example, assessment conducted in 42 audit missions across 39 centers worldwide to establish quality standards. And second one, multi-institutional clinical trials. For example, there's a hospital in London has led the first in-woman pilot studies evaluating intraoperative CLI surgery for the breast conserving surgery, like what I mentioned just now. And there were also collaborative studies involve the detections of nodal disease. And yeah, the third one, institutional collaborations. For example, Memorial Sloan Kettering Cancer Center has established a dedicated Cherenkov imaging laboratory under the Sloan Kettering Institute. And the institute, which I mentioned just now, focus on both preclinical and also the clinical CLI applications with active clinical trials. And the fourth one, industry academic partnerships. Companies like in UK, Lightpoint Medical Limited have collaborated with academic medical centers to develop investigational intraoperative CLI specimen cameras for clinical applications. Those Optics LLC has also worked with clinical institutions to develop and validate the FDA cleared beam sight system for radiotherapy monitoring, which in other words boosts the usage of CLI. And the last but not least, influence. There are 4 factors that influence our CLI, Cherenkov Luminescence Imaging, today. First will be the convergence of technologies. The establishment of CLI was influenced by technological advancement. For example, like I mentioned just now, we have advancement in terms of detector technologies. We have CCD, EMCCD, CMOS, SCMOS, etc. So the development of high quantum efficiency CCD cameras and also CMOS cameras led to the advancement of our CLI today. Second one would be the demand for radio-guided surgery. Like I said just now, it can be used in intraoperative surgery, the real-time surgery. So it's very useful. So the growing interest in precision surgery and intraoperative guidance systems has led to the increment of the CLI these days, which positively influence CLI. And the third one would be the need for cost-effective imaging alternatives. For example, PET or CT scanners cost about 1 to 2 million US dollars, and SPCT is also very expensive. And on the contrary, CLI only requires a camera like this, not really this, but more higher quantum efficiencies camera, CMOS, CCD, etc. And the fourth one would be the clinical demands. Like I said just now, we require intraoperative and also real-time imaging, and it's also non-invasive, which means our our patients today will feel more comfortable. And five, advancement in detector technologies. We also have some impacts on the society and also the people today. First one would be the economic influence. Like I said just now, it's more low cost and it's less expensive. So it only use optical equipment like the CCD and CMOS. So the people will can afford the medical bill more today if we adapt the use of CLI. And the second one would be the influence on health. For example, the CLI involve the use of real-time image guidance during surgery, and it can visualize tumor margins and affected lymph nodes. So it means that we can reduce the mortality, we can reduce the error in the human error, and so on. It can help assess tumor margins more accurately. And the third one would be the influence on optical imaging industries. For example, the CLI involve the use of cameras. So the cameras, when there is a demand for for more quantum efficient camera, there will be a demand for the optical imaging industries to develop. So it can drive and also stimulate the development of advanced optical imaging industries, and so as to reduce the depth-dependent correction and also the scatter. And the fourth one would be the improved patient's experience, which patients can feel less pain and discomfort, and also the influence on nuclear medicine field. CLI has bridged the gap between optical and nuclear imaging, which means CLI involves the use of both industries, which is the optical and also nuclear imaging. It's a hybrid mode of imaging methods in which we combine the advantage of both fields, and we come up with a more advanced, more positive equipment instruments. And that's all. Do you have any questions? Please ask so that I can improve my SMI project. Thank you.